I think that there's a growing understanding, even in the lay public, that overusing the antibiotics, that these are really precious resources. And so I think there's a few steps that you could do. First is that if a patient comes in and they're lucky enough to have something that is not requiring an antibiotic, I think it's talking to the patient about their diagnosis, pointing out the factors that go along more with a viral condition, explaining to them that that it's a relationship that you have with that patient, and that even if they're here once, that there's a way that there can be sort of a money back guarantee or a follow-up that could happen. There's some data for what's called like a preemptive prescribing, where you basically say, look, right now it looks like you have a viral infection, but if you were to progress or you had certain symptoms that sound more bacterial, we can always treat it at that time. To go over that there's very good data that most patients don't have big complications, and if it were to need treatment, that it could be done later. And then also to underscore what the tangible downsides of the antibiotics for those patients could be, including, diarrhea, such as C. diff, or kidney problems, etc. In fact, underscoring for them that one of the most common reasons for patients to come in with adverse drug reactions are related to antibiotics in the emergency rooms, etc. So to give them really not only that this probably isn't a bacterial infection, that there's a way for us to make sure that you're going to be treated correctly, and that there could be downside. And then the last actually is that sometimes there's a perception that just because they're not getting an antibiotic, that they're not getting a therapy or treatment, is that there's lots of things that we can do that are not an antibiotic. Getting fluids, resting, taking antihistamines, so that the thing is that physicians can give patients a prescription for these other supportive measures and not have to give them an antibiotic.